So my name is Dr. Melissa Bourgeois. I'm with Merck Animal Health. So I've been with them for about 5 years. Just a little bit about me. Before that, I was at Centers for Disease Control and Prevention, doing research on high-path avian influenza. And before that, I was at University of Florida getting my veterinary degree and PhD in research. So let's go ahead and get started. I know there's a lot of information about canine influenza that we might want to talk about. So a few different things with flu and dogs. First of all, there's 2 strains that are circulating in the United States right now. There's the H3N8 strain, which is the older strain, which we first discovered in 2004, and we've had a vaccine for quite a while now. And that was the strain that jumped from horses to dogs. Now, in March of 2015, we actually got a new strain of influenza virus that hit this country. It hit the Chicago area. We know from some genetic analysis on that strain that it actually came from South Korea, and it was a jump from bird to dogs. So that started in March of 2015. We don't exactly know how it got into the United States. We just know that that's when we first detected it. So, since then, it's kind of spread throughout the country. We've now detected it in over 30 states, both in many more states than that, over 36 states, actually. It has been circulating, it has been spreading throughout the U.S. There is a vaccine available for H3N2 and H3N8, and we'll talk about that a little bit more towards the end. But I want to just kind of talk about the flu first and what you might expect to see. Influenza is a respiratory disease, and I want to say all these clinical signs that I'm about to mention, they're not specific for canine influenza. There are other respiratory pathogens that could be causing the clinical signs that you're seeing. So just keep that in mind. If you do have a dog come into your facility who has respiratory disease, you're definitely going to want to request that they go to the veterinarian to get tested to figure out, what exactly it is that we're dealing with. What are the signs you're going to see? If you do have a dog come in with influenza, there's a few different things. They'll probably be coughing. They may be sneezing. They may have discharge from both the eyes and the nose. They oftentimes will have a fever, although you can't really tell that until you take their temperature. And this can progress to more severe clinical disease, things like a pneumonia, especially a secondary bacterial pneumonia, and it can even progress to death. So these can be very, very severe infections, especially with influenza. But again, I want to stress, there's a lot of different pathogens that can be involved. It isn't just flu. If you do have one of these dogs come in with these respiratory signs, like I said, it can be a number of different pathogens, but there's a few things that you want to do and you want to keep in mind if you've got this scenario. You don't want to let these dogs come into your facility for extended periods of time, and we're going to talk about quarantine and isolation. But the big thing is, how can these dogs transmit it to other dogs? So there's a couple different ways that respiratory viruses can be transmitted, influenza can be transmitted. One of them is aerosolization. So the dogs can cough, the dogs can sneeze. In fact, the average 50-pound dog can actually sneeze 20 feet. So they can spread these pathogens, and then another healthy dog will actually inhale those respiratory droplets and become infected with the flu. The other way they can spread the pathogens is through what we call indirect contact, which is they'll sneeze, the influenza virus gets onto a surface, let's say a water bowl or a cage, those sort of things, and then another dog comes along and sniffs that surface, and then they can pick up the flu. And then a third and final way that influenza can actually be transmitted is through us as people. The dog sneezes on us, it gets spread onto our clothing, it gets onto our hands, and then at that point you go and you handle another healthy dog and you can spread it that way. So one of the major questions I often get is, how long can influenza actually survive on surfaces? And that's kind of a tricky question, because some flu viruses in the wild can actually survive for really long periods of time, up to 6 months. But in the average facility, like a grooming facility or a veterinary clinic, or whatever we're talking about, the flu virus will survive for anywhere from 12 to 48 hours. On people, on clothing, and on our hands, it's going to be 12 to 24 hours. On hard surfaces that are not disinfected appropriately, it's going to be about 48 hours. So it'll last for about 48 hours on surfaces. So just keep in mind, like I said, there's a lot of different respiratory pathogens that are out there. Now the question is, if you do have a dog with respiratory disease like flu come into your facility, how long is it actually going to be infectious? And that will depend on the strain of flu that we're talking about. Now remember the H3N8 strain that jumped from horses to dogs? That strain is only shed for about 3 to 5 days after the dog gets sick. The H3N2 strain, this newer strain that we first saw in March of 2015, that can actually be shed for up to 21 days, even up to 24. So, they can be shed for extended periods of time, which is part of the reason you don't want dogs with respiratory illness to come into your clinic. Now, with the H3N2 strain, we did start to see a new outbreak that happened back in about May of this year. There were some dog shows in Georgia and in Florida, and since then a lot of dogs have traveled across the country, so we've picked it up in a lot of different states. So like I said, we've detected H3N8 or H3N2 in 36 states so far. So it's a virus that's been spreading very rapidly. So if you do have a dog come in with respiratory disease, definitely have them go to the veterinarian, have them get tested, and then have them get treated. So a few things that we want to keep in mind when we're talking about influenza virus and any respiratory disease really in general is, if you do have that dog come in and they're coughing, they're sneezing, they're sick, they've lost their appetite, they're not feeling well, you're going to want to decontaminate your facility so that you don't spread it to other dogs. So what are some of the things that you can do, and how can you do that? Well, the good news about canine influenza is that it is really, really, really easy to kill. So, even soap and water is going to do a pretty effective job. But with cleaning, the key there is to actually do it appropriately, right? So the first step is always going to be, if you've got, let's say you have cages in your facility, the first step is always going to be to remove organic material. Sweep that cage out. Remove hair, remove feces, remove any nasal mucus. Once that's done, then you want to apply some soap and water. So it's just something like, regular dishwashing detergent, and apply that to surfaces, scrub it, rinse it, and then you can apply the disinfectant. Keep in mind, with the disinfectant, we want to apply it for the appropriate contact time. So oftentimes, depending on what disinfectant you're using, that's going to be anywhere from 5 to 10 minutes. So what is 5 minutes? If you're using a product that is hydrogen peroxide, like Excel, that is 5 minutes. But if you're using something like bleach or potassium peroxymonosulfates or ammonium chloride, those are going to be longer. Those are going to be about 10 minutes. And make sure when you are mixing your disinfectants that you're doing it appropriately. So, for example, bleach has to be diluted at a concentration of anywhere from 1 to 16 to 1 to 32 in order to be active, because it comes in the sodium hypochlorite form, and you have to add water to get sodium hydroxide and HOCl, which makes it active. After you mix bleach and you dilute it in water, it's actually only good for about a week. So make sure that you're changing your containers out every week. Make sure the containers are light, tight, and airtight, because it is susceptible to both light and basically evaporation of the chloride once it breaks down fully. So after you disinfect, rinse, scrub, and dry. So again, when we disinfect, when we clean, we're going to remove the organic material. We're going to clean it with a detergent or a degreaser. We're going to rinse. We're going to apply the disinfectant that's appropriately diluted for the correct contact time. Then we're going to rinse and dry. So keep in mind, with the flu virus, we are oftentimes the people who spread the virus, right? So you want to practice good hand washing protocols, and you want to practice really, really good clothing washing protocols as well. So, when you're thinking about the surfaces that you do need to disinfect, something to keep in mind is you don't want to just clean the cage where the dog actually has been. You don't want to just clean the floors and the walls and maybe the ceiling. You actually want to clean the back of the bars of the cage. You want to clean the hinges of the cage. And then think about, where has this dog been that it might be spreading respiratory disease. So you'll need to clean the waiting room. You'll need to clean any chairs that were in the waiting room. You'll need to disinfect any surfaces that the dog may have come in contact with, or that the dog's sneeze may have come in contact with. So again, a 50-pound dog can sneeze up to 20 feet. So those are a lot of surfaces that you're going to need to disinfect. Just keep that in mind. And then we oftentimes don't appropriately disinfect other things. It's not just cages, it's not just surfaces, it's other things. It's our car keys. How often do we disinfect our car keys? It's our pens. It's our grooming supplies and equipment. It's our cell phones. How often do we disinfect our cell phones? Our keyboards. So there's all sorts of surfaces that the influenza virus can end up on that we really need to clean and disinfect. So also keep in mind that the type of surface that you're disinfecting matters. So if it's a soft surface, i.e., a cushioned chair, it's going to be really hard to get that surface clean. But if it's a hard surface, i.e., a metal surface like a cage, it's going to be pretty easy to clean that surface as long as you're doing it appropriately. So the type of surface matters, so does environmental conditions. Influenza spreads rapidly, and it can actually spread very rapidly, especially in low humidity environments, which oftentimes is what we have when we go inside to our facilities. So again, if you have that dog come in your facility and they're showing respiratory disease, you're probably going to need to institute these sanitation and disinfection measures. So a few other things about disinfection. How you apply the disinfectant can matter. If you've got a sprayer or a foamer, ideally that's what you'd want to use, as long as you're not spraying too hard and aerosolizing the virus. But if you have mops, which you have to use, which many of us do because we don't have drainage within the building, that's fine. I recommend a 2-bucket system, which is where you have disinfectant in one bucket and then you have water in another bucket. You get the mop in the disinfectant. You clean the surface that is contaminated, and then you dip it into the water, squeeze, and then put it back into the disinfectant. So it's kind of like there's a rinse stage in between cleaning up where you need to clean and then applying or putting the mop back into the disinfectant. A few things, the disinfectants that I talked about, all of them are going to be pretty effective against influenza virus, even soap and water, even alcohol. You just need to make sure you're allowing them to sit for the appropriate amount of time, and you need to make sure that you're diluting them properly. When you're washing your hands, make sure you're doing that for at least 20 seconds. That's long. That's singing your ABCs or happy birthday. And when you're washing your clothing, make sure you do it on the hot cycle, preferably with bleach. Color safe bleach is fine. And using a dryer is oftentimes very helpful as well. Okay, so if you are in a situation where you've got a dog that's coming into your facility that has respiratory disease, and let's say the owner can't come and pick it up, they didn't realize it had a cough or a sneeze, and you need to put that dog into isolation or quarantine. If you don't have an isolation facility, which many times we don't, even physical barriers are very effective. Using something like a clear shower curtain hanging in front of the cage is oftentimes very effective. I like that because then you can take the shower curtain down and disinfect it. If you are going to be in a situation where you're often seeing respiratory cases, then I would definitely just make sure that you have separate entrances for dogs with respiratory disease and dogs without. But really, I mean, if you're running your growing facility, you don't want dogs with respiratory disease. If you are going to be handling them at any point in time, you want to wear personal protective equipment, things like double gloves, a gown to protect your clothing, and shoes that are dedicated to an isolation facility. But hopefully you won't be dealing with that. So treatment for viruses is really going to be mostly supportive care, right? So, always talk to their veterinarian when we talk about treatment. The only way to truly stop the spread of influenza virus is going to be with vaccination. And there are vaccines that are available for both H3N8 and H3N2. There's actually a combination vaccine, which is made by Merck Animal Health, the H3N8 and H3N2 strain together. Now, a few things for vaccination for the flu virus. First, keep in mind, there's two benefits. There is protection of the dog that you're vaccinating, and there is prevention of disease spread in terms of providing herd immunity. So, definitely of benefit to vaccinate. We always recommend vaccination. But the thing about vaccination is that it is not treatment, it is prevention. And if you're already seeing the disease, it's really not going to be very effective to vaccinate. So you always want to make sure that you start vaccinating with enough time for the dog to form immunity. You want to vaccinate when you don't see disease. You don't want to vaccinate once you see disease. And with influenza vaccines, they're what we call killed vaccines, which means the flu virus in it is dead. So the dog actually needs 2 shots initially, 2 to 4 weeks apart. And then they don't actually form immunity until about 2 weeks after the second shot. So it's going to take at least a month, usually more like 6 weeks, for a dog to form good immunity to the flu virus with vaccination. So, we do recommend vaccinating before you see disease, because when the dog shows, when the flu virus hits the dog shows, it's really too late. At that point, disease is going to spread. So vaccinate to prevent, not to treat. Okay, so with that, I think those were some of the key points that I wanted to go over, and I'll go ahead and open it up to questions. They're not really becoming immune. Microorganisms aren't becoming immune to bleach. Bleach is still very, very effective. Depending on the microorganism, some pathogens that are what we call non-envelope viruses are really hard to kill. And only things like bleach, hydrogen peroxide, and potassium peroxymonosulfate will actually work against those. The other things that you mentioned, the Otoban, the Virkon, the Kenesol, they're all excellent for killing influenza virus and many of the respiratory pathogens. There's just a few pathogens that are not enveloped that we do recommend using something a little stronger, like hydrogen peroxide bleach or potassium peroxymonosulfates. But for flu, what you recommend is actually very good. Yeah, so we oftentimes also call it kennel cough. The thing about kennel cough is that it's basically, it means respiratory disease, and there's a lot of different pathogens that are involved. So there is influenza virus, but there's other things that we often think about, things like Bordetella. There's a virus called parainfluenza virus. There's a bacteria called Mycoplasma. There's respiratory coronavirus. I mean, there's a list of about 10 to 12 different pathogens that can cause kennel cough or respiratory disease. And unfortunately, we don't have a vaccine for all of them, but we have a vaccine for a lot of them. So definitely vaccinate if you can. But yes, respiratory disease does mean kennel cough, but it means all sorts of different pathogens, including influenza. And yes, absolutely, if your dog has not had issues with vaccination in the past, I would talk to your veterinarian first and foremost. But with older dogs especially, we tend to see that their immune system starts to fail with time. That's a phenomena that we have. It's called immunosenescence. And basically that just means their immune system isn't as good as they get older. So definitely, your 17-year-old dog, should you go to the flu shot? I do think so. Which brings me to the point, too, of what dogs do we consider at risk? And I basically consider any dog that's going to be social at risk. And what does being social mean? Well, that means, is that dog going to go outside of your house and come in contact with another dog? And if the answer is yes, then I would definitely vaccinate for both influenza and the vaccines for quote-unquote kennel cough, which is a bunch of different respiratory pathogens. So, definitely the dogs are going to dog shows, that are being boarded at doggy daycare, that are going to the groomers. If I were a grooming facility, I would most definitely require vaccination for as many respiratory diseases as we have vaccines for. But also a dog that's going to walk in the neighborhood and is going to sniff noses with another dog. There is no risk for spreading the virus. It is killed, so the dogs will not actively replicate it, and they will not shed it, so they will not spread it to other dogs. I would talk to your veterinarian. Any dog with medical conditions, you want to have your veterinarian assess as to whether or not they're willing to vaccinate or they think it's a good idea. So I would talk to your veterinarian in those cases. But definitely you want to protect most dogs from respiratory disease. And the answer is yes. The flu shot, really, the benefit of the flu shot is it decreases clinical signs of disease and the duration of disease, as well as usually the amount of shedding. So, you can still get the flu when you have the flu vaccine. It's just the disease is less severe and it lasts for a shorter period of time. So we definitely recommend always vaccinating, even though they can still get the virus. The H3N2 strain, which is the new strain, is actually much more infectious than the H3N8 strain. We see about 10 times more viral particles are shed. And then I also talked earlier about the fact that the virus is shed for much longer periods of time. So where the H3N8 strain was only shed for about 3 to 5 days after the onset of clinical disease, the new H3N2 strain is actually shed for up to 24 days after the onset of clinical disease. So it is much more infectious, they shed a lot more virus, and they shed it for extended periods of time. And we also seem to see more severe illness with the H3N2, more cases of pneumonia, even possibly some GI signs. So that clinical signs of respiratory disease, which we talked about, things like coughing, sneezing, nasal discharge, ocular discharge, they're going to be lethargic, they're not feeling well, they oftentimes are running a fever, and it can progress to pneumonia and death. The flu vaccines and the kennel cough vaccines are labeled for a year. We have shown good immunity out to the year mark, at least with our vaccine, so I'd recommend consulting the veterinarian that's administering the vaccine and which brand they're administering. But at this point, the kennel cough and the flu vaccines are good for 1 year, and we've shown efficacy out to 1 year. So parainfluenza seems to be relatively stable. Influenza virus, absolutely. So, in people we tend to see something. There's two things that we see in people. There's something called antigenic drift and antigenic shift. Antigenic drift is when the virus that is actively circulating just kind of changes a few what we call nucleotides, so it changes its DNA a little bit, and it's just a little bit different. Antigenic shift is when we have two strains of influenza recombine, and oftentimes that happens to be a mammal and a bird flu strain, using pigs as a mixing vessel. Good news, though, is that the H3N8 strain that has been followed very, very closely in dogs since 2004, since it jumped from horses to dogs. And by the way, we actually think that jump probably occurred more in the late 90s, but we just detected it in 2004. That has stayed relatively stable. So the H3N8 vaccine that is available is still very effective against the field strains of H3N8. The H3N2 strain has also stayed relatively stable as far as we are aware of at this point. You know, that could change. It is a relatively new virus. It's only been here since March of 2015, so it's been a little over 2 years. But at this point, we're not seeing significant degrees of mutation. Now, the concern, of course, is always that the H3N8 and the H3N2 strains are actually going to meet and create a new flu virus. So that is why we recommend, or one of the reasons we recommend vaccinating for both strains. Unfortunately, I don't have any updates on that outbreak. I know they did have some cases, but I don't have any further updates. So, I mean, I haven't heard anything. The biggest outbreak recently has been the Georgia-Florida outbreak. So I'm suspecting the LA outbreak died down, but I don't know. So I can't really answer that adequately. Unfortunately not. I mean, you know, if you have a dog with respiratory disease come in, the best things you can do are not let that dog stay in your facility, or if they are going to stay, practice some isolation protocols until someone can come get them. Require vaccinations. That's going to be probably your biggest thing to prevent the spread, and then practice good disinfection protocols. And keep in mind, you know, not all dogs who are sick with many of these respiratory pathogens are going to be showing respiratory disease. So you absolutely want to make sure you're practicing good disinfection protocols every day, not just when you think you've got a problem. And the answer is, you know, the kill vaccine is not labeled for use in pregnant or nursing dogs. As far as we know, there probably wouldn't be any problems, but the issue is when you have a pregnant or a nursing dog, they're oftentimes stressed and they're immunosuppressed, so they may not respond as well to vaccination as they would if they weren't pregnant or nursing. So I would definitely talk to your veterinarian before you decide to vaccinate any pregnant or nursing dogs and see what they feel comfortable with and if they feel it needs to be done. All right. I think that was officially the last question. Thank you everyone very much for coming and for spending your afternoon here. And if you do think of anything, please just reach out to GroomerTV or myself, and I'll answer any questions you have. Thank you.